This is Bwindi Community Hospital, located in the southwest corner of Uganda, close to the Bwindi impenetrable forest. The forest is home to half the world's mountain gorillas and is the former home to the Batwa pygmies. It was founded as a health centre in 2003 by Scott Kellerman, an American missionary doctor, and his wife Carol. Since then it has grown to employ almost 80 people, the vast majority of which are Ugandan, and the centre brings healthcare to almost 30,000 people in Kanungu district. Most people in the area live in extreme poverty without access to basic needs such as running water, nutritious food, electricity, transportation and a steady income. Diseases like malaria, HIV AIDS, TB, malnutrition and bacterial and parasitic infections are common to the area, which has made the expansion of this hospital and the healthcare given in the community a necessity. The hospital's maternity ward delivers between 30 and 50 babies a month, sees 160 women for antenatal care, and more than 100 women are given access to family planning. The success of the maternity ward has contributed to reducing infant and maternal mortality rates in the area. A new waiting mothers hostel has just opened, giving expectant mothers who live far away somewhere close to the hospital to stay before delivery. As of now, the hospital transfers all women needing caesarean sections to the nearest hospital, which is 2 hours away. With increased funding and resources, we hope to equip and staff the operating theatre and be able to perform these operations in the near future. The average woman in this area gives birth to 6.4 children, creating a population growth and demand that will exceed the family's as well as the environment's capabilities. This is why one of the hospital's projects is providing free family planning for both men and women and bringing this information to the people through outreach to try to delay first children, control child spacing and decrease family size. The hospital has a fairly new but quickly expanding HIV/AIDS facility that offers free testing, counselling and treatment. The clinic tests over 800 people each month and finds between 40 to 80 new cases. HIV positive people have free access to antiretroviral drugs through the JCRC treatment programme. The hospital reaches hundreds of people in the surrounding areas through outreach programmes which take place twice a week, bringing them treatment, counselling and education sessions. All pregnant mothers are tested and given free access to drugs which help prevent the transmission of HIV to their babies. The newly constructed children's ward sees around 40 patients per month, treating children with malnutrition, HIV, malaria, diarrhoea and respiratory illnesses. There are weekly education sessions on malaria prevention and nutrition for the mothers. Teaching is delivered through demonstrations and a sample garden to ensure their child has a healthy and balanced diet. The hospital also has a neonatal unit, treating newborns who are premature, underweight or have illness. The outpatients department sees almost 1,000 patients per month and treats conditions like malaria, respiratory infections, sexually transmitted diseases and dental problems. The medical staff work hard to reduce waiting times for people and ensure everyone gets immediate treatment or is admitted to a ward. Transport of sick people is always an issue. The current methods include travelling on market days when vehicles are easy to find, by helicopter, a handmade stretcher carried by people, and walking. Sometimes it can take a whole day to reach the hospital. Currently we have only one ambulance but hope to increase our number of vehicles so people who need care can be reached over the bumpy roads and rocky terrain. The adult ward mainly treats HIV, TB, heart conditions or pneumonia and sees between 30 and 50 patients per month. This ward is home to a laboratory for diagnostic work as well as an ultrasound and an X-ray machine. Staff are currently being trained to use these machines more effectively and so improve healthcare. In the near future, the hospital is hoping to expand this ward and provide better privacy and isolation spaces to its patients. The community health team continually work at a grassroots level in the communities served by the hospital. They have trained village health promoters in every village in every parish, more than 200 people in total. They are our frontline workers trying to improve health. They teach about malaria prevention, distribute family planning, provide education on safe water and sanitation, as well as screening for malnutrition. The community team also go on weekly outreach sessions to remote villages and Batwa settlements in the area. They bring clinical care, malaria education, mosquito nets and immunisations to children who live far away from the hospital. The hospital's vision is to see a healthy and productive community free from preventable disease and with excellent health services accessible to all. We are extremely grateful to all the people who have supported us in getting this far. A relatively little amount of money can go a long, long way here in Uganda. With your continued help, we can make our vision a reality.